I know a number of people that had coronavirus.
Yeah.
People that I'm somewhat close to, people who I've interviewed, and so forth. But then Fred the Godson ended up having it.
Right.
Now, Fred was never a close friend of mine. He was someone I've interviewed a couple of times. We did a music video for him. When we see each other, we'd be like, oh, shit, what's up? We'd catch up for a minute. But this is someone that I personally know. And I remember we reported on it where he was on a ventilator.
Right.
He had like a mask. You know, he took a picture of himself in the hospital.
Yeah.
And I talked to a few people around him, and early on, he felt like it wasn't a very big deal. Like, okay, I got it. I'm going to be okay and so forth. But then by the time we published that article, the doctor had told his wife that he might not make it.
Yeah.
And, you know, she had a follow-up, said, oh, okay, no, I think he's going to be okay. He's about only 70% on the ventilator now in terms of the breathing. And then we heard the terrible news that he actually died.
Yeah.
And this is the first person that I personally know that has died from coronavirus.
Yeah.
And man, it was really sad, and I think it sent shockwaves through the hip hop community.
Yeah.
Did you deal with Fred at all?
Yeah, I actually got a record with Fred. You know, 80 Empire produced this record. We're actually getting ready to release it in a couple of weeks. We recorded this song. We started working on it like maybe a couple months before he passed away, or a couple months before he was hospitalized with coronavirus. But yeah, man, I mean, it's such a incredible tragedy because he was only 35 years old, and he's like kind of this cookie cutter case now, right? Where you can point where people to this, you know, to that date, people were like, okay, well, it's only our older individuals that are dying from this, and it's not the younger people. But he was just that 35-year-old, you know what I'm saying, patient that came in and he died from it. So now it's like, nope, look at Fred the Godson. He died at 35. And I think he only had like asthma. I think he might have had asthma as a medical history. But besides that, he was a pretty healthy guy.
Yeah, I mean, well, he was obviously obese.
Right. Well, yeah.
Yeah, that was something that he's always had. This wasn't like something that developed over time.
Exactly.
He was always a very heavy set guy.
He wouldn't die from no flu. You know, he wouldn't have died from a flu or something, you know. So that was definitely a case to point to with the situation being as serious as it is for people to start taking it serious.
Is there a tie between people dying from coronavirus and obesity?
I mean, I haven't seen a direct link with obesity myself personally, and I don't think there's any like study out there that has correlated it the way I think studies have correlated hypertension with it. I know that there's studies that correlate like a 1.7 increased risk of mortality with hypertension, but I mean, I would think that there is a correlation between them because obesity is linked to all types of other conditions forming, if you don't have them, forming later on, like diabetes and hypertension. So
I know that there is a lot of talk in terms of where people feel that when they're put on a ventilator, it gives them a higher chance of actually dying.
Yeah.
You know, I mean, I know that there's some talk around that with Fred where like, I think his family feels that he would have been okay if they didn't put him on that ventilator, and the ventilator is what killed him and so forth. So is there any truth in this?
Yeah. So, you know, I'm in constant consultation with the intensivists on the ICU floor, and we actually talk about this all the time. And, you know, it's just weird, Vlad, because the patients that it's almost like once the patient's made it to the ICU, it's hard to get that patient out of the ICU. Because I would say of like 14 patients that were admitted to the ICU from me, half of them died and the other half are struggling still there in the ICU. So they haven't, maybe I think we got one or two of them out of there. But then that question arises, is the ventilator causing it? So our management in the ICU is different than the patients before they get to the ICU. So what we're doing in the ICU is focusing on oxygen. So what we're learning about this virus over time is that something about this virus prevents oxygen from binding red blood cells. It's making it difficult for oxygen to bind to red blood cells. So we give a lot of oxygen. Now, one thing the intensivist was telling me was that instead of getting the patient right on a ventilator right away, we should focus on trying to keep the patient on a BiPAP oxygen machine and trying to keep that going for as long as possible before we put the vent on. Because it's like, ever since the vent, when the vent comes on, it's like it's almost like you're not going back from that. And that's like that point. So we want to wait to put the patient on the vent as long as possible. The other thing we've been doing in the ICU is we've been putting people on heparin. And the reason for that is the other thing we're realizing about this virus is that There's endothelial damage that occurs with blood vessels, and we actually get people having a lot of blood clots forming from the virus. So that's something very unique about it. So we've been doing heparin, oxygen, and then some steroids, even though there's studies out there saying not to use steroids, but we've noticed that, patients do better with their breathing with the steroids. And then we give Lasix. So we'll give them like a whole bunch of fluids, and then we'll drain those fluids out with Lasix. So those are things that we've been doing in the ICU that's different from what we're doing with the patients on the regular floors.